This is Live Well Talk on St. Luke's new Vascular and Interventional Radiology Lab. I'm Dr. Dustin Arnold, Chief Medical Officer at Union Point Health, St. Luke's Hospital. St. Luke's recently celebrated a significant milestone with the completion of its Vascular and Interventional Radiology Lab expansion project. The newly expanded lab enables St. Luke's Heart and Vascular teams to care for more patients as the demand for cardiac and other interventional procedures continues to rise. With the expansion of technology, of course. Joining me today to share more is Lia Dickes, St. Luke's Vascular and Interventional Radiology Manager. Lia, welcome.
Thank you.
So, so previously there was 2 labs, right?
Yes. Yep.
How many do we have now?
We have 2 labs still, but we have a shelf for a 3rd lab, so we can continue to expand.
And how many cases are done on an average day?
Light days, like 10, but we can do up to probably 17. I think 20 is probably our max for a day.
And are the heart valves being done upstairs now?
No, those are still in the 2nd floor space for the hybrid OR.
Yeah. But that's the plan eventually, correct? Or
they'll go to the hybrid in the OR space.
Right. Yeah. In the new OR space, right?
Yep.
Yes, that's correct. Well, give us an overview of what a typical day looks like up in the lab.
Yeah. So our patients are now able to come into our pre and post area. So they can come in instead of going to Surgicare, they'll come to our pre and post. We'll get them checked in, do a heart and lung assessment, get their IV placed, go over their medical history. And then the doctor can come to their bedside, get their consents all ready. And then we'll send them back to the lab just behind some double doors. They'll have their procedure and then come back to us. Not all of our patients need pre and post care, just our longer sedation cases.
Right.
But some of our paracentesis, some simpler biopsies, they just check in, we go grab them, take them back to the lab, do it, and they're out in 15 to 20 minutes.
Excellent.
Yeah.
Maybe you could run through. Well, first of all, let's talk a little bit about interventional radiology. We've never done a podcast on that.
Yeah.
They're not really radiologists, right? They're more proceduralists, and they use X-ray radiology imaging studies to complete a procedure that would maybe normally, biopsy, for example, require an open procedure. So kind of take me through how that service line has grown here at St. Luke's and how the new expansion will assist that service line.
So we have 3 interventional radiologists right now. Our most recent one joined us in August, prepared right before we opened the new space. So these guys can run the CT the fluoro machine and the CT machine. They're able to go in there, move it all around, and still know the anatomy under all the X-ray, which is crazy to me because when you look at it in a picture, I'm like, how do you know what that is?
How to they take a 2D image and make it 3D in their brain. Yeah, it is pretty amazing.
This artery goes here, and we need to go this way. I'm like, you guys are astounding.
Patients, it's easier to get to. You mentioned that. And then they'll recover right there, kind of like endoscopy, right?
Yep.
And then they'll leave from there.
Yeah, we'll do all of it right in that one space.
And if they have sedation, then they require a driver?
Yes.
Yes. Okay.
For 24 hours to be monitored. So we always make sure when we do our pre-calls that they are aware of that so that they know that they need to bring someone with them.
Okay, no operating heavy machinery.
Nope.
Okay.
No signing legal documents, nothing
I've been in practice 30 years, and I don't think I've ever taken care of a patient that operated heavy machinery.
Yeah, I don't, maybe a forklift? I don't know.
Maybe,
Does that count?
Yeah, but when is it just operating machinery versus heavy machinery?
I don't know.
You need to get to the bottom of that.
I'll find that out for you.
What new technology is either in the lab or on the way?
Yeah, so we're the first lab in Iowa to have a CT and a fluoro room in the same space. So we used to have to go down to CT and general radiology and take up 2 time slots. So we would have a 9:30 and a 1:30. It's the only time that we could do CT cases because we needed to do inpatients in there, emergency room cases, and anything else that came in just as an outpatient. So now we have that capability to do that within our own lab, and we can schedule accordingly. Currently, just as we're learning the new technology, we're only doing about 2 a day still, but hoping to ramp that up and be able to take care of more patients needing that CT guided biopsies.
That's outstanding. And does Does pathology play a role in that? They can come up to this lab too, correct?
Yep,
So
they come and hang out with us for any biopsy, whether it's just a simple thyroid biopsy or a bone biopsy. They'll come up and they'll look at all the slides right there with the microscope. Yeah.
Yeah. No, I always thought that's kind of cool. Just as road construction is like a hobby in Iowa, like there's always road construction.
Yes.
Hospitals are always with projects going on.
Yeah.
This was phase 1. What was completed, and what's phase 2?
Yeah, so we did our whole lab. Phase 2 for the vascular and interventional part of things is going to be that hybrid OR. So we'll be able to move some of those cases that we weren't able to move upstairs that are still running out of our second floor space into the OR. My team in the interventional vascular lab work hand in hand with our OR team. So we'll be able to move that into the OR space and be able to provide a whole bunch of more care there.
And maybe we ought to clarify for listeners, hybrid OR. Could you define that?
Yeah. So basically it's kind of, they can go in, they can open up the patient if they need to. It's still an OR, but it's bringing in some of that interventional and vascular care. So it has that C-arm and you can still do some of that radiology piece within that lab.
So it's advanced imaging with the operating room.
Yes. Yeah.
Well, certainly this expansion is an exciting time for development of the service line. We're pretty proud of that.
Yeah.
It keeps people in their community have advanced procedures. And speaking of patient care, why'd you go into nursing?
Yeah. So I had a really good family friend of mine. She was born about 7 months after me, and she got diagnosed with leukemia at about 6 months old.
Oh, that's terrible.
Yeah. So she was like my built-in best friend. She was my mom's best friend's kid. We grew up together. And just watching her go through the hospital setting, basically for the first 2 years of her life, was just eye-opening. And I was kind of like, I don't know if I want to do that. That looks like a lot. So then in high school, one of my friends was like, do you want to go do the CNA class with me? It's free through Kirkwood, and we get to get out of high school a little early and go do this class. So I was like, yeah, sure, let's do that. So senior year, I took a CNA class, and I just fell in love with everything medical. Caring for the patients. I'm a pretty social person. I like to talk. So I was able to go and talk to the patients, and then still being able to be in the medical field and something that I actually enjoyed learning, rather than just something I was like, okay, here I am.
That's really cool. I'm still trying to figure out what I want to do when I grow up.
Yeah.
I'm not sure. Yeah, I haven't settled on anything yet. Leah, thanks again for joining me and informing our listeners about St. Luke's Vascular and Interventional Radiology expansion. Once again, this was Lia Dickes, St. Luke's Vascular and Interventional Radiology Manager. To learn more about St. Luke's ongoing $25 million Heart and Vascular Center expansion project, visit unitypoint.org/CRHeart. unitypoint.org/CRHeart. Thank you for listening to Live Well Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.